Hello and welcome to World Insight from Beijing. I'm Tian Wei. We continue keeping our eyes on the COVID-19 pandemic. The coronavirus has infected more than 700,000 people, and the number is still growing. It killed over already 34,000, with the number continuing to soar. As the situation intensifies globally, China is facing more pressures of imported cases. As of Sunday, 700 imported cases have been confirmed. So will there be a resurgence in China? How can the country handle the uptick in imported cases? Earlier, I talked to Dr. Zhong Nanshan. Professor Zhong is China's leading expert against COVID-19. Let's listen to this exclusive interview. Professor Zhong Nanshan, welcome to our program. I want to start by asking you, what do you consider would be the biggest danger facing China today in terms of resurgence of COVID-19?
Yes, I suppose the most important risk factors will be import passengers. So because inside China, so we have not too many patients now infected from human to human transmission. So so quite well under control. However, so now the importers is getting more and more. So up to now, today I've heard, so it's about 600 patients imported getting infected. And I've heard in a few patients, import patients, they transmit to other persons. So that's what I'm worried most at this moment.
But on the other hand, there are 14-day quarantines for all of the passengers coming into China. Within those 14 days, the incubation period would expire. So how much danger really is there, except the danger taking place on the plane?
So this is something we are thinking about. So 14 days quarantine, I think it's long enough to avoid that transmit to other person. So the policy, because we have a lot of exchange between countries, so we have to find a way trying to shorten the time. And then usually 14 days. I'm thinking about the 7 days maybe. So we're doing some trial. Arrived in China, so we'll have a PCR testing. And after 7 days, probably PCR repeated, and the IgN, serum IgN as well. So double check if it is all shown negative. So probably the patient will be free. That's what we think about that.
Professor Zhong, however, when the rest of the world, the number of COVID-19 patients grow exponentially, you're going to see many more coming back to China. Even now, there's regulation against the people with a foreign passport, but you have the Chinese nationals living overseas coming back in huge number. Would China be able to handle that, even though with the suggestion of 7 days you just raised?
7 days, I think that's need to be tested. So what I had mentioned about that, I'm very much worried about the imported transmission. So all of them should receive RNA test. That's the first. And then keep quarantine. So nowadays it's 14 days. And then maybe shorten. So that's we're going to see and try. Because more and more overseas Chinese will be coming back. And then I think that's a big problem for us. But anyway, so we cannot stop them coming back. So I suppose we need to think more way, in particular, so-called double check of the subject, and then I suppose we'll be more safe about that.
But even if life in China gradually returns to normal with preventative measures in place, many are still raising concerns over asymptomatic carriers. As imported cases rise, some say asymptomatic carriers now pose the biggest risk. For answers about that, let's take a listen to what Dr. Zhong Nanshan had to say. The other thing people have been talking about is asymptomatic patients. Now, how many are there really that would lead to concern of experts like you? And do we know about the percentage as to how much of them are there in terms of the overall population? Do we have any number to support these kind of concerns?
Quite frankly to say, I don't have any number. I mean, in any study showing the asymptomatic patient, how many patients are there. But I think the terminology of asymptomatic patient is not all of those people. I think the most important people are those who have the history of close contact of the infectious patients. So those persons who had a close contact with the patients, and they are sometimes they are getting infected, but without symptom. We call that asymptomatic patient. They are the so-called virus carrier, but they are very infective. From our study, it is shown in those group of, they are very infective because they have a very high virus load in their upper airway. So this is a very special group.
How infectious?
I'm not worried about that. All the people are so-called, a lot of asymptomatic patients.
How infectious?
How infectious?
Yes.
I think so. You should know the so-called showing the infectivity. How infectious? Some one up to now, maybe in foreign countries, maybe one infected with 3 or 3.5, very high. We call that RO.
Yes.
Reproductive not. So this is the terminology. So infecting. So this is the very high contagious. So I suppose in the United States at the moment they are doing some survey. I think this is something because the number of infected patients going up very fast. However, the mortality is remain about not higher than 2%. I think they had make some works to looking at some ordinary people without symptoms and see what's happening.
Professor Zhong, some have been suggesting, epidemiologists suggesting, that actually China could have the number in terms of how serious asymptomatic cases are in terms of percentage of the population, because there were people coming out of Wuhan before the lockdown, and they are scattered in various parts of Beijing, Shanghai, other cities, which is easier for the Chinese scientists like you to get research about. But people have not found out much in terms of asymptomatic patients spreading to the others. What do you make of this methodology some have been suggested? Would that be a way to figure out how asymptomatic patients are in China?
Well, I don't think at the moment, at this stage, we have a huge asymptomatic patients. So I suppose in the beginning, you can see the mortality in Wuhan is for something like 5%, 6%, and so on. So in other words, a lot of patients had not been diagnosed. So making the denominators pretty low. So that's causing a high percentage of death rate. But right now, in the other cities or provinces, the mortality is only 0.9% or 1%. I think that's reasonable. So I suppose we don't have too many asymptomatic patients. If so this kind of patient will be transmitting to other people, so making the number higher. But now actually it's going down, and also some of the provinces is returning to close to zero. I don't think that's a big problem now. I think in dealing with this kind of diseases, very infectious diseases, we have two policies. So perhaps strategy. One is suppression, and others mitigation. So in China, we choose suppression. Nobody can stop the spreading or stop the infection of this kind of disease. But we can try to do our best to inhibit the spreading. So that's what we are successful.
In recent weeks, China has sent aid to more than 85 countries around the world, including the hardest hit European countries, Italy and Spain, as well as throughout Africa and Asia. The aid is in the form of medical supplies and experts with experience fighting COVID-19. As more countries are struggling with the coronavirus outbreak, China is also sharing its containment practices. But is China's strategy used earlier applicable for others? Let's find out the answer from Professor Zhong Nanshan. Professor Zhong, if you were asked by, let's just say, your colleagues in Italy, your colleagues in New York, your colleagues in California, and your colleagues possibly in some of the Asian countries, what would you suggest to them? Will the China way, as you earlier pointed out, since the 23rd of January, be able to work for them?
I think principally, I think it should be. So because they are, at the moment, all the foreign countries like in Europe or as well as in United States, they have set up this kind of policy. So they call that the lockdown, the cities or some others. But exactly, so not down a city is not useful. So you block the change, the communication between the cities and other cities is not new. It's not the main point. So you have to so I just now mentioned about so keep distancing. So people, if inside the city, as I heard from some of the foreign countries, said, well, we lock down the city, and then inside the city, people just, in particular young people, just join together, attending parties or some banquet or meeting, and it doesn't work. It's not locked down. So we lock down, the concept will be going to the community setting. So keep at home and to avoid to contact other people and not attending the meeting and not attending the banquet. That's very important.
So, Professor Zhong, if you had the chance to talk to Dr. Anthony Fauci, of course, the US CDC people, so, what would you suggest to him?
If I discuss with him, Anthony, I think he will agree with my point. Because Lipkin, Professor Lipkin, he quite agree with what I mentioned about. First is trying to, it's not in the whole country, just like now in the United States, just an outbreak in California, in New York, and some Massachusetts, New Jersey, and some places. But however, I mean, in China, so at that time, at the very beginning, just outbreak in Wuhan and Wuhan area. So not happen in other area. So we cross that down. It's very useful in dealing with that acute infectious disease. The best way, the oldest way, and the best way is to isolation. The isolation.
Yeah.
So if I talk with him, I think they should take the same policy, because he's a well-known epidemiologist.
What do you think about the global pandemic, the situation right now? What kind of timeline and time frame are we looking at?
So I'm only focusing on China. So I suppose the China will basically under control at the end of April. Right now, I still say that's true. So, and also I had mentioned about, so in the world, maybe in June. But now it depends on what policy some other country, in particular large country, the leaders of the countries, what action they are going to take. So if something like, not exactly the same as that in China, but take based on the same principle. So national control, or have some quarantine and distancing and something like that. And then I suppose the disease, the global disease, the infectious disease may be basically under control in June. Still think about that. Except maybe some of the country, because that's have a big infectious disease of human being. In the 200 countries, any country didn't follow this principle, so it will not be under control in June. However, if all the country follow this principle, I suppose it will happen in June. I never say will be eradicated. I just said under control.
Yes.
Basically under control.
My interview with Dr. Zhong Nanshan. Professor Ian Lipkin is one of the world's top infectious disease experts, also known as the virus hunter, has tested positive recently for COVID-19. Earlier in February, he came to China at the invitation of Chinese authorities to help in efforts against COVID-19 and met Professor Zhong Nanshan. Meanwhile, 17 years earlier, in 2003, Professor Lipkin was also in China to help fight with SARS. He got to know Dr. Zhong at that time. So this time, during the interview with Dr. Zhong Nanshan, I asked him to offer a prescription for his friend.
He wrote me the day before yesterday. I know all the news. I then make some suggestion to him to get some medication. I hope he'll be getting well.
Yeah, what suggestion did you give him?
I think, if possible, she can get some chloroquine. And I heard he had some heart problem. So I think that the most important thing is just have good medical care. If in case he got some sputum, so I suppose he can get some N-acetylcysteine to reduce the sputum, to get the dilute of the sputum, which is a very serious problem, will make it worse. So that's what I'm suggesting.
I'm sure he noted that down very well. More cities worldwide are choosing to lock down. Well, the Chinese city of Wuhan is having its lockdown partially lifted. The Hubei provincial capital's risk level now has been downgraded to medium from high, a status it held when the city was the epicenter of the COVID-19 outbreak in China. Dr. Zhong Nanshan, head of the high-level expert team of China's National Health Commission, verified human-to-human transmission of the COVID-19 on January the 20th after visiting Wuhan. 3 days later, the city underwent strong containment measures. Let's listen in to trace back what happened and how decisions have been made since then during the early outbreak in Wuhan. You were in Wuhan on January the 18th evening, if I understand right, together with some of the other experts invited by the Health Commission.
Yeah.
Then you went with some of them to different places in Wuhan, the market,
Yes.
a hospital, Jinyantan, and also the Wuhan CDC. And then you guys had a discussion in the afternoon, if I understand, on the 19th, about what to propose and whom to propose to. So what was exactly the nature of that discussion on the 19th January afternoon? At that time, were possibility of human-to-human transmission being discussed? And who did you say things about that to, Professor?
I just asked some questions. One, how exactly how many patients are there in Wuhan being infected? And the second, whether they had some patient dying. And the third, whether they have medical staff being infected.
And then you talk about human-to-human transmission on the 20th in an interview with CCTV, if I remember right, Professor. But before that, did you talk to the policymakers about human-to-human transmission possibilities?
Yes, yes, I think so.
Okay.
So in the morning of the 20th January, so I have a meeting with our VIP a person and I talk with that. I think that's once the human-to-human transmission happens, that will be a very serious situation, serious disease. I'm glad our governor and the VIP, they accept that.
Professor Zhong, another important question
and
is...
then subsequent, and then they had taken some very strong action.
Talking about strong action, Professor Zhong, the lockdown of the city of Wuhan, that was beginning to be implemented on the 23rd of January. Now, who proposed the lockdown of Wuhan? You or somebody else, or collectively?
Yeah.
And whom do you propose that to?
I think...
what time did you propose it?
Well, I haven't discussed with my group, because I'm the head of this expert committee group. So haven't discussed with them. So most of us agree with that. So we should set up a policy of not down Wuhan. I mentioned about the principle is don't go to Wuhan and don't leave Wuhan. So that's what my subjection.
So it is a collective proposal, if I understand right, you just said. Is that?
Of course, of course. After 2 months of practice, it's totally correct. So in this way, I remember, I think the President Xi Jinping, he mentioned one word which impressed me very much. He said we should take the people's health and safety to the first priority. So in other words, this kind of action will make some, of course, great impact of economy. However, the leader said, the people's health and safe is the first. So I suppose the decision is correct.
Professor Zhong, during SARS, you are the one standing up and say, now, there's something wrong. We need to correct this. And this time, again, you are the one of the early ones among all the experts to speak out and speak out with a strong impact. And how would you be able to propose in a way that you think policymakers would accept for the benefit of the common good, Professor Zhong?
As you know, the events of coronavirus infection actually happened 3 times in this century. So the first time is SARS in the year 2003. And the second time is MERS in 2012. And then this is the 3rd time. As compared with the last 2 events, this kind of disease is more infectious. I mean, has a higher infectivity. So although, I mean, the mortality is not as high as the SARS and MERS. So this is something, as a doctor or clinician, I respect the fact.